Hey everybody, it's great to be here, here with a few friends, and we are going to talk about the evolving dental profession and advice and insight for today's graduates. It's a great topic. We've just come through one of the strangest and most difficult times in dentistry in the last, well, for me, 32 years. There might have been some before that, but definitely in the last few decades, crazy, crazy times. And we're going to talk about what's going on now and talk about the future. So we'll start with you, Dr. Golden. Okay, so why don't you introduce yourself, tell us a little bit about who you are, what's going on.
Greetings, everyone. My name is Dr. Joshua Golden. I am the owner dentist of West Sunrise Dentistry down here in beautiful South Florida. I'm a graduate of the University of Southern California. I graduated in about 2014. Super excited to be here to discuss this ever-changing dental profession, and I'm just happy to be here, guys.
Hey, great. Yeah, great to have you. Especially on a day like right now, it's kind of, you get the good weather this time of year, right? So it's really good. It's really nice. Okay.
It was beautiful when I walked out.
Tyrell.
All right, what's going on, y'all? My name is Tyrell Fridie. I'm one half of FutureDDS.
And I'm Tyler Brown, the other half of FutureDDS.
Hey, Tyler.
I'm originally from Baltimore, Maryland. Did my undergraduate schooling at Morehouse College. Currently a fourth-year student at Tufts University School of Dental Medicine.
Yep. And my name, like I said earlier, is Tyler Brown. I'm originally from Atlanta, Georgia. I attended Howard University, and and last year at Tufts, excited to graduate and get into the field.
That's great. Hey, it's nice to meet you guys. And I am Steve Thorne. I am the CEO and founder of Pacific Dental Services. So great to be here with you today. And it's going to be a fun conversation about what's going on in dentistry. So I guess we start off with just a simple question. Some of the things that's going on at FutureDDS and SNDA chapters and the opportunities that are there for students. What are some of the ways the schools have encouraged greater diversity, inclusion that's going on out there right now, and improvements that can be made? So we'll start with you, Dr. Gold. Why don't you kick it off?
I can only speak for back when I was in dental school. When it comes to SNDA, it's an amazing organization which helps allow African-American students to connect and kind of get to know each other and also help advance each other. Back at USC, when I was there were only 2 African-American students in my dental class. So if there wasn't an SNDA, I wouldn't have been able to meet the amazing upperclassmen who helped me out and helped kind of keep me going when dental school got tough. When you have the SNDA, this is basically an organization try to give you tips and tricks on how you can improve yourself throughout the dental track. So, hey, this professor normally likes to do this at this time, so you might want to start studying for this exam. That kind of community really helped, propel me forward in dental school. Guys, what's dental school like for you right now with the SNDA?
Well, we could say that the SNDA has definitely been, like you said, one of those strongholds where you can kind of build community with upperclassmen and kind of start building that safe space to kind of have those more open conversations. And I think that now currently, especially at our school, we've seen that SNDA has kind of taken a really strong initiative and kind of taking a step up and just making sure they're a main staple at our school and making sure that they're, providing the most value to pre-dents out there, doing different things like impressions days, different things like the IDID symposium, and allowing students to actually come in and get more firsthand experience and enrichment kind of activities going on at the school. So I think that, like you said, it definitely has been that for us, and it has been continuing to push forward to new heights, in my opinion. I think so.
So, for example, what is the IDID symposium? I remember talking to you about it, and I thought it was awesome. Yeah. I think we should share that with the viewers.
Okay.
Yeah. So actually, The admissions director here at Tufts, Dr. Jeanette Holloway, she created a program called I Did, where basically it is a hub of pre-dents, typically who have attended HBCUs or things of this nature, whereas we can all come together and help each other get into dental school. And she started that, and we were both a part of the program. And basically what the I Did Symposium is that she gets a group of these students to actually fly up here to Boston and come to Tufts and kind of spend a day in the life of a Tufts student and be able to talk to different admissions faculty and things of that nature, so that their resumes, their grades, and all these different things, their DAT scores, everything can be looked at and critiqued, so that they can hopefully have a better chance at getting into not just Tufts, but any dental school in the U.S. And so it's something that, you know, we've been a part of for the last 4 years. I think the actual symposium has been going on for about 6 or 7 years.
6 years.
And it's a great opportunity because, you know, we're able to look across the room and see our fellow colleagues who are at the I Did Symposium with us, and then we're all matriculating through dental school together. So it's really a great community type feel. And it's definitely been very beneficial for us.
So how do you help me understand? How do you define the pre-dent, and where are they coming from? Are they like high schoolers? Are they in college? Already through? They made up their mind?
So we have a few different events. For the I Did Symposium, it's typically those students that are getting ready to apply that coming cycle.
Right.
So it's usually undergraduate students who are, you know, have visited schools, maybe have applied before, and they just kind of need a little bit more enrichment, a little bit more tailoring of maybe application, personal statement, some DAT help, something along those lines to fill in that last piece or two to push them over the top and actually get them a seat at a school. Whereas though the Impressions Day, the Impressions Day program is more so geared for high schoolers as well as undergraduate students.
Okay.
And that's like the biggest difference between the two.
Yeah, do you wonder, because I always wonder, how do we get more students at an earlier age, whether it's junior, senior year in high school, freshman, sophomore year in college, interested in the dental profession?
And so I think it's all about, you know, getting in front of them. You know, I think social media has created this infrastructure for students in high school to be exposed to actual dental students and dentists that they've never had before. You know, growing up, I had never seen a dentist until I actually went to the dentist. You know, it wasn't like a thing. It just wasn't a thing. I wasn't seeing the dentist on TV and things of this nature in a positive light, which is another. You know,
I was going to get to that. Yeah.
And so I think now it's more accessible.
I think another thing is the impression days. Those are big as well. I think back before I started at USC, I actually did an impressions day over there. And so we had a chance to kind of walk through the school and see what the halls were like, you know, be in the dental lab. It basically make you feel like you're a dental student, so you're motivated to continue on your journey. So those impression days are big because, of course, they leave a huge impression on you.
Right.
But don't you think, back to, I think it was Tyler, right?
Yep.
Where it's just I think there's a lot of people out there that might consider dental school if they had a more positive impression about how great the profession is. Wouldn't you think?
Right. No, 100%. 100%. I think that it's also interesting because, you know, we never want to give it's a weird type of balance, right? Because realistically, dental school still is a lot of money. So if I'm telling a 17-year-old, hey, it's going to cost $350,000, but you should still do it, you know, that's also kind of weird because, you know, they're hearing that amount of money and that might just skew them or, you know, dissuade them from coming to dental school at all as well. So it's a weird balance of one, promoting the profession, but also, you know, being realistic about what it takes and what it's going to realistically cost as far as financially and, you know, effort wise. So it's a weird balance. It's a weird balance.
And what do you think about get your opinion, Tyrell, on the education part? Because my take is, you know, when I went through school, if you didn't start early in the sciences, and then if you were to turn at maybe junior year or even senior year in college and go, oh, I want to be a physician or I want to be a dentist, and you didn't start in the sciences, that's a long haul.
Without a doubt. So it's interesting because actually Tyler and myself, we both did master's programs, and it was I can speak for myself in saying that it was a similar situation for me in that I didn't necessarily get exposed to dentistry as a true career goal until maybe my sophomore year of undergrad, where I was introduced to mentors, introduced to the profession, and had a little bit more enrichment experiences where I actually found that I enjoyed doing it more so on a day-to-day when I was doing research within the field and different things of that nature and learning more. So I think it's mostly exposure. There's always a means to do it. If you want to do it, there's master's programs, masters of biomedical sciences programs which we've done, different programs like that that can fill that gap of the sciences, or to give you a better foundation trying to get into school and really make you a better candidate, and really would make school a lot easier when you get there, so you can be more successful.
So let me ask you, I know a little bit about Howard, but I don't know a ton of Tufts. The makeup in schools has changed dramatically in this is my 32nd year, and it's changed dramatically in those 32 years. So, I mean, tell me about Tufts, what it's like right now.
Man, so Tufts, again, and I guess this is a testament to the work that Dr. Holloway is doing.
And Dr.
Casberg.
Yep.
Yeah, Dr. Holloway and Dr. Casberg, they're like a dynamic duo. Yeah. And they've been, helping students from underrepresented and underserved communities get into schools since, well, obviously, since 2012 at the earliest. That's when I got into the program, and it was even before then. So, I think there's been a concerted effort to kind of diversify the field, as well as make it a little bit more inclusive and like equitable and all. And I think Tufts is kind of, in my opinion, they're leading the way, and that the numbers at Tufts are pretty much higher than any other school in the nation. And when it comes to, diversity, numbers of diverse students, African-American, Hispanic, Asian, like across the board, so you're really exposed to a lot of different cultures, and it really offers a lot of opportunities for a lot of students. Granted, it is very expensive, the school is expensive. So it can be kind of hard to make that decision, but I believe that, the support system, the kind of the infrastructures that they're building, and really kind of creating a home, a place of, where it feels comfortable to be there to an extent, culturally, right. And you don't feel like out of place as much, I would say, as I've had experiences in other programs. So
what are the students at Howard? How do they? Because that's not a cheap school to go to, right? And so what we
go to Tufts. So we go to Tufts. I just went to Howard for my undergrad. Right.
Oh, undergrad. Okay. So Tufts not cheap school.
No,
it's not a cheap school. And one of the most progressive schools too on tech and all that. I love it. What's the conversation like that I'm going to be, because we at PDS, and this isn't a PDS show, but we do bring on about the most new grads in the entire country, probably the world actually. And we're always asking how much debt so we can help them out. And we oftentimes have students fresh out of school coming in with $600,000 plus in school debt.
Yeah.
How do they think about that?
So you will see a wide array of different opinions. There are some people who are fortunate whose families have already paid off the debt. They knew they were going to be dentists before they graduated from high school. So there's that group.
We call them the silver spoon or the golden spoons. Yes.
Hey, I call them lucky.
Lucky. Okay.
So there's another group, whereas people really do stress it. They stress it early. I think when they signed the papers to come to Tufts or whatever dental school, they kind of they looked at that debt and said, you know what, I'm not going to pay this back. I'm going to get the military to do it. I'm going to do the National Health Scholars Program, whatever it may be, or the National Service Corps. Health Service Corps. They're going to pay it off some other way. Then there are some people who don't think about it. There are some people who are going to say, you know what, it's just going to be a bill that I'm going to have to pay for the rest of my life. I've accepted that. This is what I want to do. And I think it's interesting watching people's mentalities change with regards to the debt as they go throughout those 4 years. Even recently, right? I know I personally got my final loan amount in my email randomly. I'm walking outside in Boston. The email comes to my phone, and I see this grand number, you know, and I immediately start to stress.
You have to turn your phone sideways to look at the number, right?
It's crazy. I'm sending the picture to my mom. I'm like, hey, what are we gonna do? But you know, there's some things that you do just kind of have to let go of and just accept, you know, because if we're in the situation, we're in school and we're stressing about debt that realistically we have no income to pay for right now, you know, it's almost working backwards. And so I think that I know, you know, me personally, I'm pretty sure Tyrell as well, we've kind of just put that pressure, you know, to the side for the 4 years that we've been here. And, you know, starting now with help, you know, with help from Tufts and, you know, our practice management course and things of this nature, we're now starting to think of strategic ways that we can, you know, tackle some of this debt and really just see what's the best way for us as individuals to handle it.
Okay, that's great. Will you allow me to make a commentary as one of the vets,
of course,
business guys in this profession you're jumping into?
Please.
Okay, so I'm gonna give you the dental industry pitch. The dental industry is hot as hot. Been in this 32 years. It is the best time, in my opinion, to become a dentist.
Okay.
Next 10 or 15 years are going to be golden, excuse the pun, Doc. Golden. Okay. The technology improvements, and I know Tufts is leading the way with the digital dentistry, the move to so much more dental medical integration, I mean, we can go right down the list of tech and the impact tech is having. CBCT will be the standard, and we're doing it. Everybody's doing it. So great. People in the United States care more about their oral health than ever before.
Yes.
We see it all the time, every day. People are getting older and they're getting older, they're living longer, they're keeping their teeth. That is a math equation to a successful dental profession. Just simple math. More teeth, they're going to fall apart. They're going to need you. We're going to need you guys. The science around what you three can do to help people be healthier. I say it, oral health means better health. The things you guys can do to help people lessen their inflammatory chronic disease problem is just, the science is backing you up 100%. So in my opinion, you guys are coming in at the best time in dentistry that I've ever seen. And so the 350 grand debt or whatever that number was on your phone when you were holding it sideways, you're gonna pay it back and you're gonna make it back. So the money, you're gonna get there. Okay?
And so Steve, that means that if this is the best time to get into dentistry, then this is the best time for us to, I hate to say it, advertise dentistry. Using media, social media, to kind of get the word out there. I know that's something that I've been doing on my page at the Golden Dentist, allowing you to see what the day-in-day life is like for the average dentist. If we can do that, then that helps improve those numbers that we were talking about, which were going down for the African American community. We can help increase it because now it's representation. So let's say somebody like my nephew who's in high school, he clicks on Instagram and he checks out a FutureDDS page. He's like, man, these two guys are super cool. And they're giving you all these tips. Oh my God, I want to check this out. Or if he clicks over to my page, he's seeing what kind of cases I'm seeing, what my patient pool is like. And so now he's kind of getting indoctrinated into the community. And then he can even switch over to your page, Steve, and see the technology. That'll kind of pull them in and make them think, okay, well, what is this going to look like with me using this technology? So
I think you have such a great point there, Doc. If we look at, and I was curious at this data because they're prepping me for this conversation today, because the Asian groups have gone up quite a bit. They've kind of always sort of been in dentistry, but they've gone up quite a bit. And even the Hispanic dentists in the United States have gone up, and then yet we've decreased a little bit in the African American. So I'll support you guys any way I can to do that. And you know, we have double, I think double roughly the industry average of African Americans in PDS. So
yeah.
it's awesome.
And that's mainly because, and guys, this is not a pitch or anything.
No, not a pitch.
For a job soon. But the culture in PDS is pretty awesome. Basically, when you come in, it's something where we're trying to introduce you into what's going on. So ICE, Introduction to Clinical Excellence. Before COVID, we would fly them out to Irvine. You'd spend a week out there, and you're basically learning the basics of proper patient experience, CEREC, things of that nature. So when you have something like that getting you off on the right foot, and with that proper culture, I think that would be a benefit to anybody.
Good catch. Man, you're on this stuff more than me. So I was just a quick story, and then think about how we apply this to, let's say, on a national level. I'm at the tail end of my career. I want to elevate the profession. I want a lot of people to come into dentistry, and my experience is that it's a rising tides industry. Okay, so and when I started out the company, I started with, my first partner was a female, and she was from Lebanon. Okay, my second doc we brought on was a Mexican guy, and he was number 2. Then we brought on, we did bring on a white guy the next time. The next guy was an Asian guy. Then the next was an Indian guy. Then we had a Persian guy, and then back to another white guy. So that was the start of PDS. So, I mean, it was multicolored, multicultural from all over the world, actually, to start. So in our company, what Dr. Goldman was saying a minute ago, it's kind of in the DNA of the company we're always looking for the best, and then that's what we care about. How do we get that process in that belief system out there, and can really drive the diversity and inclusion for the best to come into our space? You know, what can we do there?
Particularly, I think focusing on it, making a concerted effort is the biggest thing. So now that is brought to a lot of people's attention, or brought to everyone's attention, really, you know, specifically in America, just where it's so much cultural, cultural things happening right now. It's definitely been a concerted effort on behalf of schools. Of course, like Tufts been doing it for years now, as well as, you know, ADA, as the different organizations like this who have also been helping to support. So I think just making sure it continues to remain a frontline issue of creating diversity, and not even just diversity for the sake of numbers, but diversity in cultural competence and cultural understanding within the organization. Because it doesn't matter if, you know, you boost the numbers up if the organization isn't representing, you know, being as inclusive and really creating the same opportunities, or really helping to fill those gaps that the students that haven't been there and really need more assistance. If they aren't doing that and kind of creating that equity, then it kind of softens the effect of what, you know, everyone's trying to do. So I think, again, like different things like the Idea Symposium, if it's spread to more schools, like the schools really looking into their curriculum and making sure, or even organizations that the schools offer, or, you know, create links and different situations to kind of include into their school. Like we've included different organizations like Southeast Asian Club, Asian ADL, so Asian Dental Student Club. You know, so many clubs here at Tufts specifically, and that's the only experience we can necessarily speak on. But I feel like even speaking to other dental students, our experience has been extremely unique in that way, because Tufts is so student centric in everything that we do, whether that's traveling to, you know, a certain student, IS student's home country to do, you know, work, or taking a service trip to an underserved community, different things like that, and doing things within our community. You know, even starting up like a mentorship program similar to what Tyler worked in conjunction with some faculty members working at local high schools. So it's not always just trying to do like a big grandiose thing. It's literally making sure that on a day-to-day basis, you know, all the students that you're not only just pushing to get into the school or into the profession, is that they're feeling supported and they actually feel like they have everything that they need to be successful. Obviously you need to work hard and all of that, but you know, if you don't feel like the system is built to help you, then it just adds another hurdle that everyone has to jump over. So.
Right.
Something,
Tyrell, anything to add to that?
Tyrell, go ahead.
Oh, say it again.
Anything to add to that?
Well, yeah, I mean, are we talking specifically PDS, or are we talking more?
No, I'm talking the industry.
So, I mean, like really just, I think representation, you know, and that's why, you know, Tyrell and I created our platform. You know, we were in our master's program, we typed in dental school. I saw no faces that looked like mine, you know, and it was, actually there was one guy, I think he went to like.
Well, even you had to have it if you got Howard, if Howard popped up.
Right. But it was just like, there was just no real representation.
Yeah, I get it.
And even me going to Howard, there was Howard Dental School right there. So of course, you know, I knew certain dentists. Actually, a Pacific dentist I know, Dr. Trev Thomas, great dude.
I know Trevor.
Yeah,
Trev's the man.
Yeah, man, great guy. But he went to Howard. He served as a mentor to me for a little bit. But anyway, I think representation is just everything, and that's why we created our platform. You know, so that now whenever a dental student types in the dental school that they want to go to, one of our videos is going to pop up. So automatically they're going to see our faces associated with whatever school that they want to go to. And that was one of our main goals, even going into this, just to increase representation. So,
well, I mean, you guys have great personalities, and I want to encourage you to keep doing it. Keep doing it across as low as we can go, where people are starting to think about their careers. I think junior, senior years in high school, that's where, you know, if your passion is helping people get somewhere and succeed and elevate their lives, their careers, their paths in life, we're doing that in the dental assisting world, and it's working well. This is sort of a first step for us in the dental world.
Right.
We generally, for my life, we've been bringing people in after they really in dental school, but kind of after they finish.
Right.
But this is our first shot where we're really thinking about the future and going deeper.
Right.
So that's cool. So, hey, let me switch gears here. Unless you had something to add, Dr. Golden. You look like you were going to say something.
I was going to say something as simple as having this conversation. By having this conversation, this can spark so many other things. You know, a student that's watching this, it now makes them feel that it's attainable to become a dentist because, like Tyler said, representation. I'm seeing these guys in dental school. I see Dr. Golden with a practice. These things are more attainable, so thus they want to, you know, get involved in the industry.
Yeah, if you think about like in my world on the business side, you think about the schools that I get asked to speak at schools all the time on the business side to freshmen, sophomore, juniors in college, because they still have time they don't need to go through all the sciences and all that. They still got time to think about where they're going to land from a business standpoint. We've got to have that same thought process for the dental profession, for the clinical providers, but it's got to start, I think, earlier than on the business side. You know, just from the sheer actually just very practical, the classes you got to take.
So guys, here's a question for you. What would be one of the biggest concerns you think a dental student would have right now in this industry?
So it depends on the year, right? I think that for graduating D4s, you know, I think it's more so experience.
Experience, yeah, I knew that was coming.
You know, it sucks. Nobody could have predicted what was going to happen with COVID-19. You know, this couldn't, like, who knew? Nobody knew. And so I think where we're at right now, granted, you know, limited clinic exposure and things of that nature, you know, that's especially one of mine, and I'm sure Tyrell's as well, one of our main concerns. And that's why with regards to picking our first job, you know, the mentorship aspect is huge, you know, and it's here that, okay, it's more so when you get out, you're going to be seeing, you know, more, you're going to be doing more in the first month of working than you did in your entire dental school career. And it's like, that's great. I understand that repetition is great, but we don't want those reps to be bad reps, because if they're bad reps, we become a bad dentist, you know? And so that's why we just know this first step is so huge. And I think that's probably the main concern as far as, you know.
Who do you have right now Tyler, who do you have as a mentor right now helping you on the clinical side?
A lot of people, you know.
Okay.
That's one of the blessings of FutureDDS. We've been able to meet so many people like yourself, like Dr. Golden. So we have a pretty large, bank of network. We got lucky.
So what about the other students that may not have that large bank? What would you recommend they do to kind of look out for mentorship?
So I say for anyone who's looking for a mentor, look for the type of dentistry, and we actually heard this from Dr. Lee Gauss, but look for the type of dentistry that you want to do and find that dentist to start building a relationship with. So if it's aesthetics and veneers, like find that dentist, figure out how they got to that point, figure out what your next step should be based on how they did it and what they would have done differently. If it's learning volume, if it's learning more complex patient management, it might be a residency for you versus going straight to work. Or if you want to do more complex surgeries again, might be want to go back to do an OMFS residency after working for a year and kind of reestablishing that's what you really want to do. So, you know, find the dentistry that you want to do first, or the area you want to practice in first, and then you start to build your network around that. So just really as simple as reaching out to one dentist, asking for a 15-minute conversation over coffee, and they'll connect you with 3 or 4 dentists after they learn a bit more about what you want.
Yeah, you couldn't have said it any better there, Tyrell. One of the things I've learned after all these years is to use the word teach a lot more in that first year between the kind of the more senior doc and the new doc coming in, right? Just teach them to get clinically confident,
right?
Okay? And that confidence comes through clinical competence.
Yeah.
So you call it reps. I like that word. That's not one that flows off my tongue all the time, but I'm going to use it. Reps. We talk about it on CEREC, right? Get 50 done. And once you get 50 done, okay, you're golden, or implants. And we got that down. By the way, Dr. Thomas the other day held a record. He did 2 all-on-4 cases in one day, by the way, a young guy out of school.
Yeah,
Crazy.
He's
crazy stuff. Do you see him on the list, Dr. Golden?
I did, and when I saw him on the list, I called him, and I'm like, "What did you do? What did you do?
How do you do that? How do you post up like that, right?
You drop numbers like that, and the rest of us have to try to keep up, man. What did you do?" But I was so proud of him. You know, that's so awesome.
But I find that most of the more senior docs or veteran docs, we'll call them, they want to teach you. Yeah. They want to help you. All you got to do is ask.
Yeah, exactly. And that's something that we try to encourage all, you know, young docs or young dental students to actually do, you know, because that's one thing about dentistry. I think that a lot of dentists, you know, we like to talk, you know, we like to talk to people. You know, it's just within the profession. And so I always tell people, you will be amazed at the ability for an older doc or whatever it may be, a doc graduating from school, that they actually will take that time out to really talk to you and give you not just that 15 minutes. Granted, you should ask for 15 minutes just to make sure you're not taking up too much of their time.
It's going to turn to 30, 35. You got to cut them off. Hey, all right, I got to go run.
I got to go study, right. So, no, so you're right. Dentistry is a helping profession. Mentorship runs throughout this entire field. And we've seen that, and we really try to preach that to the new dental students.
So, do you guys have any questions for me?
Ooh.
I've been doing too much talking.
I know we were talking a little bit earlier about, you know, what schools are doing to kind of start reaching down a little bit younger and starting to pipeline more students in. So, you know, I just kind of want to get an idea of your overall vision for PDS. You know, is it to continue to enrich dental students now, or do you want have the passion to necessarily reach down and kind of start creating the programs for, you know, those early undergraduate, late high schoolers? Because you seem very passionate about kind of starting to mold from a younger age and kind of making sure everyone's prepared from that younger age. So, like you said, PDS is starting to get into it now. I guess, what is your overall vision, or what is your dream goal for what you want it to look like in the next?
Steve, you could maybe give them a little insight on what we talked about earlier today, just a little taste of it.
Yeah, well, I'll touch on that. So first and foremost, I got to keep the golden goose going. The golden goose that keeps laying eggs, right? All the dental offices, we have about 850 around the United States. We're going to do another 600 in the next 5 years or so. We've got an incredible owner doc model. We've got incredible systems. We're moving over to Epic right now. We've got 122 offices on Epic. We're building a fintech company. We're implementing CBCT. And I say we're doing all that because at PDS, my goal and our vision has never been to be the biggest. It never has been. It's always been to be the best. And I always knew if we were the best, we'd be one of the biggest, okay? So we're at this technology evolution in dentistry right now, and we're putting that infrastructure in. So I'm super pumped, and I want to when I hang up my cleats, I want people to say, you know, he built an enduring institution that is great for oral health, not just dentistry, overall oral health. We're helping people be healthier and happier every single day. Scholarships for dental assistants. I think this year we're doing 45 or 50 scholarships. We have a mobile dental clinic. We have a clinic for special needs patients in Arizona that is also a residency with NYU, so the students can come in the pediatric program. So we get to do all these things. Now, what Dr. Goldman was just alluding to, I have one of my senior team members wants to do a bit of what you guys were talking about earlier. He wants to develop now a program within the organization he has a passion for helping people that may not have had all the opportunities I did, or, you know, I don't know all your backgrounds, but maybe not all those opportunities. And he wants to find those all-stars out there and help them develop in markets with an emphasis on dentistry, for sure, okay? But help them with some money, with mentorship, and things like that, starting in high school. And Dr. Goldman and I were talking, hey, my wife does some of that right now. And so I already connected them on the via text today, because we're doing that. It's called our DIBE program. I can't remember what DIBE stands for, D-I-B-E, but anyway, but we're on it. So we get to do those things because we are a profitable organization. So yeah, I'm super pumped on all that. I like that stuff.
I'm super excited about it, guys. When I heard about this, I was like, this is exactly where you want to be.
No small ideas. No
Right.
small ideas.
Hey, I love that. Yeah.
Okay.
I have to be.
Thank you, Tyler, Tyrell, for joining us.
Of course.
Dr. Golden, great to see you again and just talk shop and just talk about this great profession we're all blessed to be in. It really is a great time. I thank you for all the work you guys are doing with the FutureDDS program, because they need to hear the full perspective of what's out there in dentistry, what's available. Yeah. There are so many avenues, so many places students can go. Yep. And it's just an incredible opportunity, incredible time. You guys contact me anytime you want. I know my team who helped put this all together, they'll connect us if any of your students want to know anything, and I post, they can track me down if they want. So
thank you.
No, we appreciate the opportunity. We know both of you all are very busy.
Man,
I've been working all day, so we really do. We appreciate y'all for sure. Thank you.
No problem.
Yeah, thank you. Tell all those tufts students to tough it out, and good things are going to be coming. I tell you. Okay.
Yeah, definitely,
yes,
definitely.
All right, thank you guys so much for coming. This is a great conversation. I know it's just the start, but I want us to continue to have dialogue like this, because I know at the end of the day, this is going to help so many people in the future. So thank you, Steve, for your time. And guys, thank you for being awesome. Let's do this again. Let's not be strangers.
We will, for sure, for sure. Okay, take care.
All right. That is not the end, everybody. We still have our Q&A, And also at the end of this conversation, you guys saw that Steve was alluding to an amazing program that we are piloting. Patrick, can you give them a little info about that a little bit more? I know when everyone heard that money part, their ears perked up. So can you talk a little bit about that scholarship opportunity?
Yeah, thanks, Dr. Goldman. What we were talking about there and what we're trying to start at PDS, and we're in the process of doing so, is looking at a way to get to people earlier, people that don't have opportunities. And when we say earlier, we want to dig down into high schools, because you guys all know when you were making your career decision on where you wanted to go and what you wanted to be, for most of us, that started to happen around the end of high school, beginning of college. So if we could put some money to it and give people exposure, I believe in exposure. That's the biggest thing, is that people don't know how great the dental industry is. People don't know that even inside the dental industry, it's not just about being a dentist. You could be a hygienist, you could be an operator, you can be at the VP level, whatever it is. So the program's going to be,
and the number one thing you hear, the number one thing you hear for most people, I hate the dentist. So we need to change that narrative. If we can get more people involved, like you said, Patrick, and they can think about these other jobs like a hygienist, like a regional back office trainer, somebody who's training the assistants, like my amazing lead assistant, Erica. These type of people can actually grow in the profession, going from a dental assistant to somebody who trains dental assistants to even an office manager. So there's so many avenues in the dental profession. And so the program that you're starting, we can help spark that conversation.
Yeah, and we're excited about it. I mean, Steve's backing it 100%. We've got buy-in at all levels. Be partnering with Dr. Goldman and some of my partners. But the biggest thing is putting dollars behind it and giving people opportunity that, okay, I might like this avenue and it might sound good, but we talked a lot about the financial part. Well, if we can help with the financial part as well, now we really break down some of the barriers that exist.
All right, so guys, something I wanted to touch on, we talked about sparking the conversation. Something that helps kind of spark this conversation, this dialogue, is SNDA. This organization has done a lot to get, people of color through dental school. Can you talk to me about your particular SNDA chapter?
Yeah, so definitely. Our SNDA chapter, I believe we're a very active chapter in that we put together a lot of programming. Even through COVID, we've been able to put together some programming for our school, for our students, just kind of creating that community. We actually do have one of the largest African-American minority communities in dental schools, even more than like Howard. And I believe we have more total students, African-American students, than even Meharry right now, because we have, I think, 50 per class. I think Meharry is the only school that has more than us. But in terms of SNDA presence, in terms of minority presence and support, I think our chapter has been doing amazing things and has been extremely inclusive. Again, like we spoke about it earlier, the Impressions Day program that we do, this idea symposium things that we do. Granted, we haven't been able to do that in person the last year or so, but still that mentorship aspect, being able to reach out, even connecting and having, throughout the week, having our students speaking with previous graduates, different things like that, where we're able to still build those type of connections, still build that mentorship, not only from dental students to future docs, but from dental students to pre-dents, as well as, undergraduate and high school students. So it's been amazing. It's been a great experience so far. And I think we'll just continue to innovate.
Awesome. And then you were talking about mentorship. Something COVID has taught us, we have to be creative. And I know a lot of students have actually reached out to me via social media looking for mentorship. There's one student who's in the process of applying, and I constantly, every week, I send her a message to kind of see where she is in the process. Right now, she's supposed to be studying for the DAT, but she promised she would hop on this call and then get back to studying. I have another student who's actually in high school. She messages me once a week, and we kind of discuss random dental topics that she's seen across Instagram. So when it comes to mentorship, it can kind of come in all shapes and sizes. Can you guys both give me examples of maybe one mentor that kind of stands out? I know somebody we talked about, Tyler, was Dr. Trev. That's somebody that you've worked with. Can you give us an example of a mentor that stood out to you?
Yeah, I mean, you know, which is really interesting. You know, granted, Dr. Trev has always been a great mentor towards me, but even, you know, randomly, you know, one of the beautiful things about FutureDDS is that people will reach out to us, older docs who, you know, who appreciate what we've done or whatever it may be. And even like last week, I got a new mentor randomly. You know, he gave me a call. And, you know, he just wanted me to talk about what I was doing and just wanted to give us some guidance about what we should do in this next step, because it is a very pivotal step, you know, and it's a big step for us, makes us very nervous, but I mean, we just want to make sure that we're walking in the right direction. And so, you know, honestly, over the years, so many different mentors have reached out, and literally every person that I meet, honestly, who's especially like older than me in the dental realm, I consider them a mentor, you know, for sure. So there's really a lot, too many to count, and I thank them all the time.
Without a doubt, you know, a lot of the things that Tyler was saying, I could definitely piggyback off that. He echoes, or I echo a lot of the sentiments of, you know, recent graduates, you know, people who've been practicing for 20, 30 years and have a different perspective. You can gain a lot from each one of these people. So people like Dr. Holloway, who now works in admissions, she doesn't practice clinically anymore. You know, Dr. Leo, he's works in pre-clin with students at Tufts. Even to, you know, not even just dentists, you know, or general dentists, but even like Dr. Coombs, we were able to speak with him. And honestly, any little conversation that inspires me, I consider that to be a form of mentorship. Yeah. So, you know, watching YouTube, getting inspiration from that, you know, actually having those weekly combos or those monthly combos, or just tapping in with older fraternity brothers, different things of that nature, where I'm able to kind of understand what their experience is and gain a new perspective. So I think I found a lot of mentors in some of the most bizarre places, some of the most random places I would never find. A lot of times mentors and inspiration in my peers as well. So I think we don't have to look as far as we believe. We have to find inspiration and find, you know, someone who we just knows a little bit more than we do. Right.
I know one question that popped up that caught my eye was, when should a dental student start looking for a job? Can you guys give me a couple of examples of what you did or what's your recommendation?
Okay.
So I always say do it early. You know, it's funny because a couple of our friends, they decided that they wanted to wait towards, you know, April, May, which is okay, I guess. Okay. But something that I feel like both of us was like seeing contracts early on and being able to decipher what was a good and a not so good contract, you know. And you will see a lot of different
not
contracts.
So good contracts.
A lot of people were nervous. A lot of people still are nervous about the job market with regards to, you know, this COVID situation and us, you know, unfortunately having less clinic time. But I mean, from what we've seen, the market, you know, people are still looking for dentists, and people are saying that they're interested in mentorship, which is a huge aspect of who we're going to ultimately decide who we're going to go work for. But yeah, I always tell people, get on it early. And honestly, if you kind of already have some leads, whether that be a dentist from your hometown or, you know, your mom, your parents might know somebody that you kind of know, but not really, you can start working on them. I'll say it like that, working on them, you know, beginning of your 4th year. You know, why wait? Why wait?
Yeah, definitely build those relationships regardless. Even if you don't plan on working there, it's always good to have, like you said, more mentors, more perspectives, more opportunities. And even if you don't want to work for that doc, they might have the perfect situation for you. You know, it's like, okay, well, I'm a very high volume office. You want to do more aesthetic boutique dentistry? I actually know a guy who does that. He enjoys doing that a lot more. He'll be a good mentor. He could easily, you know, that's a better connection than you trying to cold call an office because you like the work or because, you know, it just happens to be in the area that you like. So I think having that aspect, definitely getting into it early so you can get used to hearing the language, used to hearing, like, seeing the numbers. Like, you know, it's hard to wrap your mind around certain type of numbers, certain type of situations when you've never really been exposed to that. So I think just getting used to having those conversations that can be a little tricky. Start early here.
Patrick, can you talk about how some of the docs come into your region and, you know, they need a little guidance? What have you done to help docs start out?
Yeah, I want to piggyback on what the guys just said. Yeah, that starting early is so critical. As somebody who helps doctors hire other doctors, and we help our owners bring on docs, the docs that come in earlier, we know those are the all-stars, those are the high shooters, and we're going to probably prioritize those guys rather than the people that wait. And then you get interview experience. There's nothing like going through the interview process several times to really get your skills up. So I really like hearing that. As far as development, again, I think the theme is mentorship, is hooking a young doc up with the right mentor doc, giving them the resources and tools, and giving them the reps, as you guys said in the video, is getting repetition, but it's getting a good mentor and having a structured mentorship. It's not just, hey, call me when you need me. It's regular scheduled meetings. We're going to look at charts together. We're going to go over your verbiage, whatever it is, on a regular cadence. That's the way you ramp a doc and help them be successful early on.
I see a question. Who do you guys have review your contracts? What have you been doing? Because I know right now you guys are still free agents trying to figure out exactly where you're going, but who helps review your contracts?
Yeah, so we actually have a really great, I guess, financial literacy faculty member here. Practice management faculty member at Tufts who will help us, you know, walk through contracts, what everything really means, what the implications of one contract versus another is, in terms of like insurances, capitation plans versus HMOs, PPOs, all these different things, and really understand like what you want, because that's the biggest thing. I think the biggest thing is what you want. So find a doc that you like or that you want to practice like, and have them review it, because they've either signed an associate that, you know, that is pretty much in your position now, and they understand what that deal should look like, or they've been in a situation where they have been an associate and they either had a really good experience or a really bad experience and can tell you, and they can kind of comb through some of those things, the mistakes that they've learned about, as well as, you know, just kind of give you an overall idea of different things that maybe you should add. So a couple of different people, just find a trusted doctor, honestly. Find a trusted doctor who practices in the same style that you want to practice, and then find someone who, if it's a dental CPA, and I'm sure none of you maybe know about a dental CPA already, maybe not, but try to reach out to like maybe a dental CPA, or if you have faculty members on your faculty, please just reach out to them, because they're a lot more willing to help than you would think. Like, they're a lot more willing to help. So I don't know who you had to look at your contracts. But.
Like you said, the practice management professor. And I have one piece of advice to people. Don't let too many people see your contract, because what I found was I was reaching out to like 6 or 7 people, and somebody's going to find something that they're just like, no, you should not do this. And that's with any contract. So you start having doubts when it really might be a good opportunity, and certain things that they value, you may not value. So like Tyrell said, know exactly what you want. Know if you care about, you know, if you care about that 5,000 sign-on bonus, is it worth it? Is it worth it, you know, to get this great mentor? Like, maybe it's not worth that 5, because you'll make it, you know, later on, or whatever it may be. So just know exactly what you want. I say pick like 3 people you really trust, you really appreciate their perspectives, and at least 2 of those people should kind of know you, because they can kind of say, okay, I kind of see how you work. I understand what you want. I think this will be a great opportunity, or not a so good opportunity. And also, everybody, your first opportunity doesn't mean it's your last opportunity also. I think that, you know, it's weird. We've been put in this weird position where it's kind of like, which sucks, but it's almost like you all should be grateful to get a job anywhere type of situation. Yeah. I feel like I've been getting this weird pressure from just people, right? Yeah. But we're graduating. We will be doctors, and we have the skill set to produce. So realistically, you can go wherever you want to go. So if you do end up signing and you're not happy wherever you are, granted, I know there's a lot of 1-year contracts or whatever it may be, but if you're not happy, don't ever feel like you are trapped, you know, because I think that's another feeling that I initially had, whereas my first job was going to be my last job. And this was such a major decision that I almost got like what is it called? Like
It
I
seems-
stalled.
Yeah,
What was it?
it's like paralysis by
Exactly.
analysis.
Exactly.
Or something like that,
Exactly. So it's weird, and you all will all go through it. But yeah, good luck.
We're still going through it now, so
Yeah.
it's not like we have all the answers, but that's what we've learned so far.
Your experience is live and in color for you right now.
Yeah.
Here's another question. Is there anything you wish you learned as a high school student that would have better prepared you for your dental journey? Let me hop on that one really quick.
Yeah, please.
I think back to when what I knew about the dentist is just, a dentist does drill and fill. That's all you really knew about the dentist when you were growing up. But if I would have known that this profession has so many avenues that I can, turn on, I would have probably hopped on a lot quicker. I didn't really get interested in dentistry until maybe towards the end of college. So now in dentistry, I'm a business owner. I'm allowed to, have speaking events with cool guys like you, the social media aspect. So there's so many things that keep me going on an everyday basis. And then on top of that, I get to do the hand skills and I keep things going. I have a fabulous staff that keeps me entertained every day. Like literally today, my dental assistant asked me to help her with her homework. So it's like I'm out here reading a paragraph, trying to help her get her life together. And it's cool. That keeps you fresh. That keeps you going. And I can't think of anything better to do. What about you guys?
Kind of like you kind of touched on, I think it's just exposure. Like realistically, and people ask us this all the time, like, is there anything I can do in college to prep before the summer of dental? I'm just like, look, dental school is going to hit you regardless.
Yep.
I think as far as a high schooler, I think it's really just that exposure, because neither of us thought about becoming a dentist until kind of like you, we were in college. And I think we could have definitely better prepared, whereas we could have taken, classes or whatever it may be to like stay on track and actually go straight into dental school, which would have been great, but not for everybody. But yeah, as far as high school, just go shadow a dentist, get more exposure, know that it is a possibility. Yeah. And I think that first starts off with, especially students of color, being able to see examples. And so that's why I'm glad that, we're all here today. So
without a doubt, I think when you put it in perspective, if you're in high school, you realistically have 7, 8, 9 years until you're going to be a dentist. So it's not necessarily what things you can do right then to become a better dentist, because you still got to learn the science. You still got to, it's a lot of foundational things that you still have to do. So again, like Kyle said, maybe exposure, even, just visiting offices. Yeah. And if you really know, if that's something that you're passionate about, that's something that you're going to want to do, like volunteering, maybe, doing different things like that, just to get a little bit more experiences and a little bit more enrichment within the field. So,
Pat, I know you're not a dentist, but you work with a lot. Can you give me an example of something you wish young Pat in high school would have known about?
Man, it's funny. I wanted to be an orthodontist. I don't know if you knew that, Dr. Goldman. I took the DAT. I was a bio major. I switched courses and did something there. But what I wish I had known is that it just wasn't about being a dentist. I kind of got into dentistry by accident, kind of the back way. But I wish that I had known at the time that it was, you could be in dentistry without being a dentist. And I kind of figured that out the long route. But there's so much to this industry. There's so much to this profession for any non-dentists that are on here that, man, and that's why we're looking at the scholarship program, is just introducing people to such an unbelievable profession that has so much opportunity. I probably wish I knew, I was talking to somebody recently and they said something like, yeah, when I think of the dentist, I thought there was one front desk person, one dentist, and one hygienist. They don't know there's so much behind the scenes that's part of it. So I wish I had a little bit more exposure to that side of things.
Hey, we wish we had more exposure to that also. Hey, well, we're getting there. We're picking it up.
That's right.
All right. I see that we're starting to get to the end. So, guys, I want you to give one piece of advice that that's going to change somebody's life. Go ahead and give me that one piece of advice. Tyler, I'm looking at you because you're looking real deep right now. What you got?
Yeah, I'm locking in. Okay. Oh, boom. Okay. Think bigger. I think that I think a lot of times our ideas really are, I don't want to say small because there's no such thing as a small dream, but like we can literally do anything that we want to do. And that's outside of dentistry. That's in your life, you know, and you know, unfortunately, a lot of that comes from exposure. But, you know, hopefully, you know, we can pass this message on today. This message can pass down to the youth, whoever, that you literally can do whatever you want to do. And, you know, we are testaments of this. And, you know, we featured other dental students on our channel who have had realistically a lot tougher situations than we had coming up or going through, you know, the dental school journey, whatever it may be. So literally never doubt yourself, bet on yourself, and yeah, do whatever you want to do because you can.
I say one thing I typically try to live by is all we can do is the best we can do is all we can do. And when I say that, it's like literally if you're putting 100% effort into something and that's your dream, that's your focus, and you're dedicated to it, you're going to get it done. Yeah. Like whether it takes you doing a master's program, whether it takes you going to hygiene school first, whether it takes you whatever it is it takes. It may be a longer journey than someone else, so never compare yourself to another person, but all you can do is what you can, and the best you can do is all you can do. So, you know, if you keep that in mind, you might get a bad grade on the test, you might mess up a prep here, you might not do as much community service as you thought you could because you're studying for classes, but if you know you're putting in 100% effort, you can't, you know, you shouldn't look negatively upon yourself. You should always be proud of the effort and the work that you're putting in, and it's going to work out in the end. So just keep that faith, keep that focus, and it's going to work out.
Testify. Pat, you know I'm coming to you. What you got next?
No, it's there's nothing that's going to stop you. If you have that mentality, not a person, don't look, hey, it's going to cost too much money, or if you have a goal, don't let anybody tell you can't do it. And don't let anything stop you. There's money out there. There's mentors out there. There's opportunities out there. You're going to stub your toe. Nobody got to where they are without making mistakes or falling into some pitfalls. Don't let them stop you. Plow along, hook up with the right people, and just don't let anybody stop you.
Perfect. And so I'm going to combine everything you all said. Hard work pays off. Don't give up. Don't ever give up. If you can get 1% better every day, imagine where you'll be this time next year. So yes, it's going to be hard. Yes, you're going to stub your toe and fail a couple of tests, maybe here or there or something like that, but you need to get better. You need to still learn that information. Do what you need to do to get better, because everybody started somewhere and you just have to work hard to get where you dream to be. So never give up, never surrender, basically. All right, so we're going to go ahead and end there. I truly appreciate you guys for coming on. Tyler, I know you stood in for our boy and helped him out while he had that clinical emergency. We had the technical difficulties. Patrick, thank you so much for jumping in. I truly appreciate all of you guys. This was hard work. Thank you for dealing with the technical difficulties. Here is our amazing info page. Feel free to reach out. If you ever have a question, or if you ever have any doubt about something, I know I'm here for you. The guys at FutureDDS are here for you, and Patrick's here for you, and Steve Thorne's here for you. Reach out, let us know, and we truly appreciate each of you. Thank you so much for joining us, and have a great night.
Thank you all.
All right, now, thank y'all.
Thanks, everybody.